I'm up at 5 because it's quiet. What's really nice is knowing I don't have to go to work after 43 years of healthcare, to be able to just plan a fun day. My motto is, don't stress over the small stuff and enjoy the day and just be thankful you're alive. It's a blast. I love doing this. It really wakes you up, gets you going for the day.
She's doing fantastic. A true success story. She's very dedicated, always here at class, and she always works very hard.
Some will argue the brain is the central part of the body. I think it's the heart. I was a critical care nurse for 20 years. What got me into cardiology was when I was 6 months old and my father passed away. He had had a massive MI, or myocardial infarction, heart attack. My mother now is a widow with a 6-month-old, and 2 years go by. My mom is on a date set up with a mutual friend, and her date walked in, and the first thing he did was he sat on the floor with me and played, and my mother was saying, I'm gonna marry that man. This is my favorite picture of my parents. I really cherish this photo. He ended up being probably one of the best things in my life as a wonderful father. Well, when he turned 40, he went into congestive heart failure. Those events made me so interested in cardiology. I knew from the get-go.
We wouldn't be here had it not been for Karen's love and friendship. She skipped over from the medical side, being on the medical side for us, to our friend. Karen was there through the process of when my husband first had his heart attack. From that point on, she took us under her wings. And then as my husband went on, she was our confidant, our leader, our motivator. When Karen and I went to Vegas, I said, okay, Karen, let's go. And Karen wasn't herself. We were in the room getting ready to go down, and she just stood up and kind of like, I said, Karen, what's wrong?
I had a feeling I knew why it was happening from a diagnostic standpoint, in that I had sleep apnea. And when you have sleep apnea, you drop your oxygen levels, you become what they call hypoxic. That is a stimulus to the heart to go into an arrhythmia. So I would wake up with it. Getting up, checking my pulse, I find right away I know I'm in atrial fibrillation. I get angry and frustrated. Well, it wasn't until I ended up with a couple of long-lasting episodes, and one was precipitated by stress, so it happened during the day, and one was precipitated by exercise, that led me to saying, come on, you're at risk for stroke, and you got to take care of this. I have seen patients walk into our clinic in AFib and just fall over. I didn't have that. I had sort of subtle changes and shortness of breath.
When she told me all this was going on with her, and she said she reached out to Dr. Sue, and was like, okay, this is going in a really good path.
So I came home and I called him. And I said, Dr. Sue, I'm in AFib. And he goes, well, I have this new cryoablation catheter that I'm really excited about. And it's a research protocol. And having done research for almost 11 years, I knew the gig, basically. And what I said to him was, let's do it. 2 weeks later, I had my ablation. When I was rolled into the cath lab, I couldn't believe all the people that were there because of the complexity of what needs to be done. It's pretty amazing. Knowing that I participated in a trial that's been approved and is going to help other people makes you feel like you contributed. Maybe that was what my point in life was, because I think as, just from a life perspective, we all wonder, okay, what's my purpose? Tomorrow is not guaranteed. Seize the day.
Yes.